Good morning, and thank you everyone for joining us for the June webinar. We're ready to go.
Great. Well, good morning, everyone. Thanks again from myself also for joining us for the webinar here today. My name is Michelle Lang, and we're going to be talking about dynamic seating, specifically with a focus on using dynamic seating to diffuse force and to provide movement. So diffusing and moving. I'm an occupational therapist in the Denver, Colorado area. I've been working in assistive technology for quite a number of years now. I have the privilege of working in many areas of assistive technology. And when I'm working with wheelchair seating and mobility, one of my areas that I have always been very interested in is dynamic seating. A lot of the clients I see benefit very much from this particular area. And so I'm excited to talk with you about that today. This is a CEU event, so we have our learning objectives here. One, the participant will be able to define dynamic seating. Two, the participant will be able to list 3 clinical indicators for use of dynamic seating for a client who has increased muscle tone. And 3, the participant will be able to list 3 clinical indicators for use of dynamic seating with a client who seeks out movement. So today we're going to be addressing just what is dynamic seating, particularly for those who may not be overly familiar with this area yet. Then we're going to dig into how dynamic seating provides movement for our clients and diffuses those forces. This webinar, as Beckett mentioned, is sponsored by Seating Dynamics. And just so you're aware, I do consult for Seating Dynamics part of the time. I work with a number of different companies as well as clients in my practice, but I will present this information as objectively as possible. So just what is dynamic seating? Well, dynamic seating is movement which occurs within the seat and or the wheelchair frame in response to forces from the client. So you can see in this little illustration here, this is a Netty wheelchair. It's not available in the United States right now. This client is extending. They're exerting those forces, and the dynamic components absorb those forces, and that in turn assists the client back to their starting position. So there's some help assist with that return. Dynamic seating has a lot of different goals, but we could kind of lump those goals into 4 primary ones. The first is to allow movement. So all of us move all the time, at least I sure do a lot, and we're allowing movement for our client. Some of our clients really seek out that movement. Second, we're diffusing forces. So if our client is using sustained or intermittent, maybe a combination of strong forces, those are diffused. Third, by diffusing those forces, we're protecting the client, we're protecting the seating system, mounting hardware, and the mobility base. We have probably all worked with clients who have caused damage to their chair, maybe snapped a head support clean off the chair due to these forces, and this technology can be used to protect both the client from injury, but also all that equipment. And then finally, to improve postural control by providing movement within a limited range, we can see changes, particularly in trunk control and head control. So let's talk about this a little more, because we're going to dig down deeper today into these first 2 goals. By providing movement in the wheelchair, as this adult is clearly seeking out, we can, for many clients, increase their tolerance to sitting in the wheelchair and compliance with sitting in the wheelchair, because now they can move. We're providing vestibular input for the client. We can increase alertness and decrease agitation. There's some nice research out there that shows that movement can be used with many populations, really with just about any of us. It's the way our brains are wired, to help us be more alert and less agitated. We are also reducing maladaptive behaviors in some of our clients by allowing them to move. improving overall function for some clients through movement, and certainly providing some degree of active range of motion. Also, by providing movement, we can prevent the wheelchair from moving or tipping over. So we have some clients that we work with who move so much in their wheelchair, their static wheelchair that does not accommodate that movement, that the chair might bounce across the room or even tip over. So we're trying to provide a place for that movement so that that does not occur. Providing movement within the wheelchair itself can prevent breakage. That video we were just looking at, we'll talk about Phillip in more detail in a little bit when we get to a case study. Most of the movement he's created in his wheelchair is not dynamic components at all. It's wear and tear. He has made his wheelchair into a dynamic wheelchair. We fortunately were able to provide a more permanent solution before it fell apart. Providing movement can prevent client injury as well, because instead of the client encountering that static surface with force, that surface moves and diffuses that force, and that movement can help with that. And we might prevent loss of client position, because the seating system will move with the client instead of the client moving within the seating system, resulting often in a loss of position. Our second goal that we're getting into today is diffusing force. So by diffusing that force, by absorbing those huge forces some of our clients can exert, we can reduce active extension and we can reduce energy exertion. So some of our clients look like their main goal in life is to escape their wheelchair. They're fighting it perhaps all day long. By providing this force diffusion, it might be that now, instead of fighting the system, the client can move, forces are diffused, and now I'm exerting less energy. And by diffusing some of that extension, I can reduce overall extension throughout this client's body. In turn, that might help. Here, sorry, I have to be loud for just a second. There we go. I had to close a window. It's getting a little too loud outside. So we can also help our clients increase sitting tolerance and compliance, decrease agitation, and increase function, because instead of the client pushing and pushing against their wheelchair seating system throughout their day, they can now use their system in a more functional way and hopefully not have that agitation. So by diffusing that force, we can also prevent breakage of the chair because that force is now diffused. We can prevent client injury where the client might have pushed and pushed and pushed or banged, leading to injury in their body, part of their body. I've seen a lot of clients who have tremendous amount of force built up in their knees, for example. If that force is diffused, we don't have that happening. We can reduce pain for the client, and we can reduce shear forces. And if I forgot that loss of posture, we can prevent that as well. All right. Easy to make all these claims, right? But do we have anything to back it up? Well, we have some. Not enough, but we do have some research out there. There's also some research that's in process right now. So I'm hoping that a year from now, we can point to some more information, more evidence. You know, dynamic seating has actually been around for a while, but is seeing somewhat of a resurgence in clinical application. I think part of it's because we have some newer product options over the last number of years that weren't available to us before. With that said, dynamic seating does tend to be used more outside of the United States, in Europe and in Canada, and so some of the research is coming out of those areas where funding is sometimes more successful. We'll touch on funding before the end of this webinar as well. Now, we don't have any research that actually says dynamic seating provides movement, because it's self-evident that dynamic seating moves in response to client forces. That's its definition. We do know that some of our clients seek out movement, often for sensory stimulation. You know, I'm convinced, and I'm sure a lot of you would agree with me, that many of our clients have quite a bit of sensory deprivation because they're stuck in these positions. They may not have independent mobility, may not have the opportunity to move through their environment, explore, and seek out that sensory input. And unfortunately, a lot of our clients don't have as much touch as other people may. And that's very unfortunate, but a lot of our clients don't have folks coming up and touching and moving them very much. So our clients are often seeking out this stimulation. This research in 2011 was published in the American Journal of Occupational Therapy, and it discusses the effectiveness of sensory integration interventions in children with autism. Now, a lot of the clients we're working with who can benefit from dynamic seating have a lack of mobility, and so autism, although it could be a secondary diagnosis, is not generally the primary diagnosis. But this study did show that vestibular input movement can reduce maladaptive behaviors. So we can extrapolate that dynamic seating, since it provides movement, can reduce maladaptive behaviors by providing that movement. We also know from other studies that this movement can also, again, reduce agitation and increase alertness. Some of the same researchers in 2008 did another study talking about those disco sit cushions, those little air circular cushions that sometimes are used in schools on top of a standard classroom chair. And they found that attention improved. So this is yet another study that shows that dynamic movement can increase attention and alertness. And I have seen this in my own practice. I have a number of colleagues who have noticed that once clients are provided with movement, alertness definitely increases. This particular study was done by a group in Italy, and they specifically looked at movement analysis of someone using dynamic seating, particularly people who had cerebral palsy. So it was a movement analysis comparing movement that occurred when the client was sitting relatively still in their seating system, and then during that extensor thrust pattern, where we see that global extension in the body. And they did this with a rigid back and then compared it with a dynamic back. And the results were that when using a dynamic back, there was decreased extensor thrust, increased range of motion, which makes sense because the client can move and they couldn't before, decreased vertical trunk movement. Now that's that shear that occurs. If I'm in a static seat and I'm extending, my bottom's lifting right off the seat and my back is moving up the back of the seating system. There was less of that because the movement is now going where it should be. Instead of the client experiencing those shear forces and standing up in their seating system, now their back is actually moving in a posterior direction. There were also decreased upper extremity movements, and the team that did this research believed that this was because the client had movement going where it should be. That movement was being absorbed, and they didn't see the overflow in the upper extremities, or the client may not have been stabilizing as much with the upper extremities during movement. So bottom line, dynamic seating was found to diffuse this force. Barb Crane and a group of folks, Roy Cooper, Doug Hobson, over at University of Pittsburgh back in 2007, also did some research about dynamic seating. They were specifically looking at whether this made a difference in terms of comfort. But they did find that dynamic seating resulted in the reduction in spasticity. So again, we're diffusing force. So reduce the intensity of that spasticity and also reduced contact pressures. Again, instead of the client's force encountering a static surface and building, it's diffused. The clients had better postural stability, better comfort, and improvement in functional abilities. They noted there was less damage to the seating system and better vocal and breathing ability, which was interesting as well. This is another group out of Italy. This is an older study, but it's a good study where they looked at a dynamic seating system. This was one that included dynamic movement at the back, the feet, and the neck. And they found there was a decrease in the intensity and duration of extension at the trunk and head level, less hyperextension of the head during spasms, less involvement in the lower limbs, meaning there wasn't that overflow into the legs when they provide movement at the back. There was a greater consistency of anatomic parts with the components of the posture system. That's kind of a mouthful there. But what they're basically saying is that the client remained in alignment with the seating system. So we didn't have that shear, that movement of the client within a static seating system. So the correct posture was maintained, and there was reduced amount of energy exertion. They, like the Crane study, also found improvement in swallowing and a consequent reduction of saliva. So bottom line here, dynamic seating was found to diffuse these forces and have other benefits as well. Now, if you find that you need some backup when you're recommending dynamic seating, either to educate team members or to help with funding situations, there's a literature review on dynamic wheelchair seating that you can find on the Seating Dynamics website under resources, and it's something that I try to keep updated. So look at the date on the bottom of it. I do try to update that about every 6 months, and like I said, there's a few research projects that are in the works right now. So I'm hoping, again, about a year from now, we'll have even more info. Again, if you have any questions, feel free to type those into the chat box at any time. I'll grab those along the way, and we'll also have some time at the end to discuss those. Jason, I see you have a question about handouts. You will be receiving a PDF of this PowerPoint, so you don't have to write down every single thing I'm saying. And if you're typing, please keep typing. All right, so today we are discussing two main goals of dynamic seating, and the first is allowing movement. So most wheelchair frames and seating systems are static. The only movement that occurs is between the client and the seating system. So the client's going to perhaps move within that area if they're able to. Some of our clients are not. They're in a completely static position. If the client is moving around within their seating system and the seating system does not move with them, then the client's going to lose contact with some of those support surfaces. For some of our clients, that means a lack of stability, a lack of support. That means a loss of posture, as it has for this young lady here, and for many of our clients, decreased function. We know that movement, through lots of research outside of wheelchair seating, is linked to increased alertness, decreased agitation, reduced maladaptive behaviors, and increased sitting tolerance. I certainly can sit through a long movie much better if I can wiggle around in my seat. This little girl here is in a static seating system, and she is really checked out. Before she received dynamic seating, she spent most of her day looking, at least, as if she was asleep. She didn't wake up and participate until she was placed in something that moved. Active movement through dynamic seating can provide movement at the joints, typically at the pelvis, the knees, and sometimes at the neck. And that can impact active range of motion some. Now, it's not a huge impact, but there is some movement there, and it's going to depend on the dynamic components, how much movement is available. If there's a tremendous amount of movement, we also could have a loss of posture, or for some of our clients, they might end up reverting back to more extension. So it's finding that good midline position between no movement and excessive movement when we're looking at dynamic seating. We saw this video before. So many clients are sensory seekers and rock. This guy here likes to rock all day long, and he has absolutely rock and rolled several of his chairs apart. Again, we'll talk about him more later. Dynamic seating can facilitate the movement that some of our clients are seeking and fill that need. Now, this is a philosophy thing. I've certainly spoken with colleagues who will say, well, we need to stop this person from moving because they're destroying their equipment. They need to stop rocking all day and pay attention. Maybe they're stimming, they're engaging in excessive stimulation. Well, each case, of course, is individual, but my bias is let them move. I find that a lot of clients, once we provide that movement, definitely rock and roll for quite a while, but often then settle down and do begin to participate and be more functional because they know they can move when they need to. By providing movement, we can also keep the client from bouncing across the room or tipping over. Now, there are clients who have, per our latest terminology, high threshold sensory processing modulation disorder. These clients seek out sensory input. They have a high threshold. It just doesn't register unless they get a large amount of input in a certain sensory vein, such as vestibular. So this is felt to be secondary to the inability to detect where their head is in space in relation to gravity within normal sensory parameters. That's kind of a mouthful, but that's our current wording and terminology when it comes to sensory processing and these clients that are seeking out their movement. So it's important to provide that movement, and some of that ideally needs to involve the head to help push that threshold up until this is registered. Banging against the back of the seating system or bouncing in that seat provides increased tactile and vestibular sensory input. That provides the client with feedback necessary to calm and quiet their emotional and physical state. And that can actually result in postural improvement. So again, I know this is kind of wordy. You'll have this in your handout, but this is some of the wording that might be required to have a discussion as a team about why this person truly needs movement as a part of their seating system. So let's get back to Phillip and talk about his case in a little more detail. Phillip is an adult with developmental disabilities, and he definitely seeks out movement. He's in a Quickie Iris manual wheelchair with a linear seating system. Phillip rocks. He rocks with such force that the wheelchair tends to move across the room and is at risk of tipping. The team locks his wheels because they're trying to prevent the chair from rolling across the room. But he rocks with so much force, it's a little hard to see in this picture, that his entire wheel is covered with these bite marks. He's broken off pieces of the tire where it contacts the wheel lock because that's how much force he's using. I think a lot of our clients are exerting more force than we realize. Some of my clients, if I watch them, they may not look like they're pushing with a lot of force with their legs, but if I try to move their feet, they're cemented to the foot plates. They're actually exerting a great deal of force. When Phillip starts moving, it looks like he's just kind of rocking around, but this is how much force that he is creating. I cannot imagine sitting in his chair and me contacting the back with enough force that I could break off a chunk of this solid tire. Now, the interesting thing is someone along the line decided, you know what, Phillip, needs a dynamic back because he is moving so much. And they put a dynamic back on. The back they happened to choose was from Quickie, but the back failed because his movements were so forceful. So when I looked at the back of this seating system and noticed the Quickie dynamic back, I noticed the elastomers in there were the wrong color. Well, the elastomers that came with the Quickie dynamic back had gotten quite worn, and so the team there at his facility had found some elastomers actually from a seating dynamics back. So when he was moving, this dynamic component was actually not moving at all. He had worn the wheelchair frame and this dynamic back so much that he could rock without actually compressing the elastomer. So the reason his back was, quote, dynamic was really wear and tear. It was sloppy holes around the bolts and screws within the wheelchair frame. They had worn to an oval instead of a nice tight round hole. And so there was a lot of movement in the frame, but really no compression of this elastomer. So the dynamic back is not absorbing the forces at all, and his chair was at grave risk of implosion. Here's Phillip moving his head. I'm going to make this quiet for a second. So Phillip was banging against the head support so much that he has worn off the hair on the back of his head. He is not balding. If you watch, as he hyperextends his neck, he's kind of shearing, creating shear forces at the very top of his head against that upholstery, and he's worn that off. Again, this is deceptive. If you just look at the video, you might think, well, he doesn't look like he's pushing that hard. There's quite a bit of hard work keeping that pad in place, and he's still moving it a bit. So we recommended a seating dynamics dynamic rocker back interface. We needed to provide movement not within the frame, but movement within a dynamic component for Phillip. It can be locked out for transport. That's this red piece here that's not locked in this video. And it's very durable because he shows us that he's already shown that he needs very durable equipment. We also recommended some dynamic head support hardware to move with Phillip and diffuse that force because we know that he's exerting enough force behind his head to wear his hair off. And we want to better absorb that, not just give him really tough hardware that he can't break, but absorb and diffuse the forces. So I was at a conference recently, actually in Philadelphia, and I saw one of Phillip's therapists, and she told me that he was doing very well with the new components and that he was really enjoying the increased movement. And so far, so good on the wheelchair. There's no new damage. He hasn't had this for very long, and they're excited about the fact that we're anticipating he will not have the damage he's had on his chair in the past. Now I'm going to play this video clip in a minute. They just sent this to me, which I really appreciate. And in this particular video clip, you'll see he's not moving the dynamic footrest, but his therapist told me he actually moves them quite frequently, just not during this video. Also, the other thing I noticed in this video, and I've already spoken to his therapist, is the pad is a little too far back behind him. So he's not really activating the dynamic headrest hardware in this yet. He's moving the back quite a bit. And it's because the headrest is just too far back. So they're going to move that forward. They've had difficulty in this facility. People keep moving it back to get it out of the way of the sling during transfers. But it needs to be a little further forward to do its job. So let's see how he looks here. So you can see that Phillip is moving. He can move more than he could before, but the dynamic component is taking the force. So that's where the movement is occurring. That's where the force is being absorbed rather than shaking his chair apart. All right, again, if you have any questions, feel free to type those into the chat box or any comments. This would be a great time to do so. We will have time for questions at the end as well. So the second goal that we were going to address today after providing movement is diffusing force. Now the two do go together, but these are discrete goals and goals that we may place into our documentation. When the client exerts force against a dynamic component, that force is absorbed. And then that stored energy returns the client to a starting position. A lot of our clients are very capable of moving a component, but without that energy being absorbed and helping the client return to starting position, many of our clients would just move to that full range of the dynamic component and stay there for long periods of time. So that ability to store and return the client is very important. By moving and absorbing forces, the client cannot exert leverage against those surfaces, and that includes the back, the foot plates, and the head pad. I think it even includes the seat. A lot of my clients leverage their thighs off of the seat and they push into these surfaces. When that surface gives, it takes the leverage away. It takes the wind right out of their sails. So for example, if you're sitting on a mat table behind a client and they're fighting you, they're pushing against you, typically what we'll do as a therapist, for example, is allow that client to move back somewhat. I'll lean back, wait for that tone to settle down a little bit, and then bring the client back forward. In essence, I use my body as a dynamic seating system. If I lean into that client and try to fight them and not allow that movement, I'm probably going to lose. And that's even with some of my youngest and lightest weight clients. This is not a function of age or weight. Even some very lightweight clients can exert a great deal of force. All right, we have a question about funding from Austin. Hang on to that, Austin, because we're definitely going to talk about funding before the end of this webinar. So thank you. Diffusing force reduces active extension. It breaks that pattern up. So again, just like you are sitting behind a client on the mat table and they extend and you let them and then bring them back, it diffuses that force. And sometimes it can keep that full-blown pattern from initiating altogether. So here on the left, Spencer is showing us just how much force he has. He is standing up in his wheelchair, but he's in a Kid Rock here. The Kid Rock is a dynamic seating system that's no longer available. It was discontinued, but it provided movement at the back and at the knees at the same time. And the seat moved upward to help the client to return to a neutral position. So despite this huge extensor pattern, Spencer, boom, lands back into position, and he has not lost the position of his pelvis. Without dynamic seating, he would extend like this within his seating system, and then when he finally stopped extending, he would end up losing his posture, where with dynamic seating, these extension periods of time were much more limited. He wasn't able to push with the same amount of force because it was that leverage was taken away from him and he could return to that position. So diffusing force reduces active extension. This is Spencer again, and this is Spencer now that the Kid Rock has been discontinued. He's using Seating Dynamics dynamic footrest here. And when he extends, they very readily move. So instead of standing up in his seating system, this really takes that leverage away from him. In turn, that helps to increase sitting tolerance and compliance, decrease agitation, and increase function. Because again, instead of standing up in the seating system, the client can actually be more functional. So this has worked out very well. And compared to the Kid Rock for Spencer, what's been really nice about these dynamic foot rests here is that they're separate. The Kid Rock, if you're familiar with it, was one single foot board. So if the client moved on just one side of their body, sometimes that footboard didn't always move or move very readily. These move individually. So if the client extends with more force on one side of their body, which you can see Spencer here often does, one or both foot plates can move together. Now, the design of the dynamic component itself is very, very important to prevent loss of position, particularly in the back, because when we allow the pelvis to move rearward with a dynamic back, force is diffused, but the pelvis may not return to a neutral tilt upon return to upright. So think about how you're seated right now. Let's say you're sitting up nice and tall, and you go ahead and lean back, and then you come forward again to your starting position. When you lean back, it's very easy for the pelvis to fall into a posterior pelvic tilt. So each of these dynamic components have different strategies to prevent that from happening. The Kid Rock had a seat where the rear, the most posterior portion of the seat, lifted up as the back seat to back angle opened, and that was to try to maintain the position of the pelvis. Each company has their own strategies to do that. So let's talk about Eddie. This is such a great picture. Eddie is a teenager with cerebral palsy. He also has quite a bit of seizure activity. He has very strong extension and an extensive history of equipment breakage. This can be a real funding dilemma. It's hard to keep approaching funding sources and say, I know the chair's only this old. I know the seat's only this old. I know this mounting hardware's only this old, but it's broken again. So durability is important. If the equipment breaks, the client is sometimes at risk of harming themselves. If there's sharp edges, let's say, that are present now or exposed. Also, certainly if the client is exerting enough force to break equipment, they could be putting themselves at risk of injury. But we have to keep fixing things for the client. And I've had clients who have broken things to such an extent that they can't use their chair until it's repaired. Now we have a client who, instead of actively participating, going to school, going out in the community, is laying in bed. And we know that's not a good thing. So Eddie had a linear seating system in a tilt and space manual wheelchair. He repeatedly extended against the back. Well, sometimes when he would throw himself forward, this is his back here, and he's leaning way forward, and he'd throw himself back, he would collide with his lateral trunk supports. And he would break them clear off. So here the pad is missing. It has broken off of the hardware. Here you can see on the plywood base of his linear back where the lateral hardware was attached, he's snapped that clean off. So huge, huge amounts of forces involved here. So as the seating system didn't move in response to his movements, Eddie would extend against it with a lot of force. And he would do this throughout his day. That used up a tremendous amount of energy. And instead of using his body for functional activities, like using his communication device, he was fighting this battle with his seating system throughout the day. Now that he has a dynamic back, he has not broken any more components. He's in his late teens now. He has a long history of breakage. And again, since receiving this, no breakage at all. His movement has also been reduced. Now, I've noticed with a lot of my clients, once they know the system can move, instead of using really huge movements throughout their day, may look like they're not moving at all. And I've questioned sometimes whether this client really needed dynamic seating at all. What I have noticed is that my clients are moving, but it's just a little bit at times. It's just enough to ensure that there's not that point of resistance, that I can move. As soon as I latch that back on these clients, it doesn't take them very long to note that it's not moving. They hit that point of resistance and bam, we see that huge extension again. So not uncommon for a client when they first receive dynamic seating to move a lot, but over time to show these small amounts of movement. They just need to know it's there. This is a great quote from Eddie's mom. She states that when he first got the dynamic back, he rocked all the time. He doesn't move as much now, but she thinks it's because he knows he can if he needs to. So years ago, Eddie started in a kid cart. He then moved into a Zippy Iris. Eventually, he was placed in a PDG Stellar manual tilt chair with a Ride Designs back. I think the reason his team put him in a PDG was probably because it's a very durable chair and he was breaking things. But it really wasn't the fault of the chair. He needed dynamic seating. So about 2 years ago, he started using a dynamic back from Seating Dynamics, and again, since that time, has not had any breakage. Because the dynamic back provides the movement that Eddie needs, he no longer leans forward, throws himself back. Instead, he just rocks with the back movement. And Mom also says that rather than standing in the chair when he was upset, and we sure have seen those clients, right, who stand up in their chair, the back moves and Eddie doesn't lose his posture. There's definitely less force to his extension. And finally, she states he enjoys life more now. And again, this is Eddie moving in his chair. And despite those very large movements, he's maintaining his seated position. He's not standing up in the chair, and that allows him to have better control over his posture. All right, we have a question here. Let me get my cursor over there. All right. Question is, how do you set up or deal with a client with less than 90 degrees popliteal angle that could benefit from dynamic seating back and footrests, but need a contracture frame for hamstrings? If I move the client forward, it changes center of gravity a lot. If I keep them back, the angle where my knee sits pulls the client out of the chair due to hamstring tightness. That's a great question. First of all, with dynamic footrests, if someone has really tight hamstrings, dynamic footrests are designed to move in 2 directions, depending on the manufacturer. Well, sometimes up to 3, actually. So that dynamic footrest, first of all, telescopes. It goes downward towards the ground and then typically extends forward. If the client doesn't have the range, they probably just won't take advantage of that forward motion. If somehow they're able to, they could lose the position of their pelvis, but usually they're just simply not going to be able to move in that direction. It's possible to order a Seating Dynamics dynamic footrest so that it only has a telescoping feature. And I often do that with people who have tight hamstrings. So their force is absorbed, but in a downward direction. There's no knee extension. That in combination with the dynamic back usually works quite well because moving rearward actually takes some of the pull away, the stretch away from the hamstring anyway. If you have to move the client's entire chair forward a bit on the frame to deal with the tightness of the hamstrings, that's something that definitely you need to work with together with the supplier to look at what frame can we use to accommodate these tight hamstrings, avoid the caster interference, and not mess up the center of gravity more than we have to. There's quite a variety of frames out there, and sometimes there's some options. As long as the back is attached to those back canes, the dynamic back should still be in a good relationship to the client to work during movement. The center of gravity is really more frame design issue. So I hope that helps. Great. And if anyone else has any other questions or comments, feel free to type those on in. All right. Another question we had was funding, and funding is always a big deal. Can we get funding? Yes, it depends on the funding source, of course, and Medicare, well, that's very, very challenging. But insurance companies and state Medicaids often will fund dynamic seating without an issue. Documentation is really important, and part of the challenge I find with dynamic seating is that a lot of funding sources may simply just not be aware of this technology. They may not understand what dynamic seating is, and unless we have the option to send them a video, it's hard to explain dynamic seating. It sure is a lot easier to just show someone. It is possible to send a link of a video. For example, there's some YouTube videos that Seating Dynamics and other companies have, as well as videos on their website, and say you can take a look at this if you want to see how dynamic seating works. There's no guarantee that the reviewer will actually do so. They have extremely limited time. So it's really on us to document well why this is required for this individual client. So something that I wrote up to help with this is some sample medical justification wording. And there's different wording for different potential scenarios, including providing movement and including diffusing force. You can go to the website and download that for free. Just feel free to cut and paste and customize it, of course, to your individual client's needs. And hopefully that will be helpful to you. So usually I do not have, again, with state Medicaid and insurance, any funding difficulties with this. If you are having funding difficulties, feel free to contact me. I might be able to give you some suggestions that would help as well. I do try to take pictures and video when I can to help support the funding process. It is challenging sometimes to find a way for them to receive video depending on the funding source. But that documentation is still very important. If we just simply show a video of Phillip rocking in his chair, a funding source may misconstrue that as, well, that's just Phillip having fun, and not realize how important it is for him to provide that movement and to protect his chair. It's more cost efficient in the long run. So here's our take-home message, and then I'll open us up for more questions and discussion. Dynamic seating provides movement of the seating components and/or the frame. Providing movement for the client can increase sitting tolerance and compliance. Sitting tolerance is kind of our new word for comfort. Comfort's a bit of a red flag word in our documentation, but sitting tolerance is not. It's very important to increase sitting tolerance and compliance, allowing the client to really use their equipment. We're providing vestibular input. That in turn can increase alertness, decrease agitation, and other maladapted behaviors. By diffusing some of that force, instead of the client fighting their seating system all day long, instead we might see an increase in function as the client can now use their body more functionally, and we are providing some degree of active range of motion as well. Dynamic seating can provide movement of the seating component and/or the frame to diffuse force. That can reduce active extension. We take away that leverage and in turn reduce energy exertion. That can also help to increase sitting tolerance and compliance, decrease agitation, and increase function for our clients. So again, our focus today has been primarily on providing movement for the sake of movement, vestibular input, and also diffusing forces, taking the wind out of those sails and really reducing that extension. There are some other Numotion webinars. You can get some more information. In January of 2017, I recorded a more generic session on dynamic seating, and this one again has a little more of a focus on movement and diffusing force. On August 21st, we're going to have another more focused dynamic seating session where we're going to go into more detail about protecting the client from harm as well as the equipment. There's a whole bunch of resources that are available to you. I write a blog twice monthly for seating dynamics. I encourage you to check those out. There's also some other resources, including a decision-making tree, clinical indicators. One of those clinical indicator documents for diffusing force and providing movement is one of your handouts today. That literature review is there, as well as sample medical justification wording. So I want to thank you very much for attending today, and make sure you have all this good contact information, and we'll take some more questions. So Austin has asked, what about Medicare funding for dynamic seating for someone with Huntington's disease? Have you had any success with Medicare funding? Oh boy, you know, dynamic seating is just custom made for someone with Huntington's. Huntington's is such a challenging condition where we have extremely large and forceful movements. And dynamic seating can really help absorb those forces and protect the client and keep that chair from tipping over. And sometimes that is required in combination with a pretty darn stable base. A lot of those clients use PDG bases as well. I am not familiar personally with whether Medicare has funded a system for that population. I sure hope they have, and some of those clients are also because of their living situation. If they're in a long-term care facility, sometimes funding can really be challenging with that as well. I would suggest, Austin, that you contact Seating Dynamics, particularly Ted at Seating Dynamics, and I am going to, well, let's see, we have their website here. If you go to the website, you can fill out a contact form, and Ted will be able to get back to you about whether they've ever had successful funding for Medicare, and I am going to ask him as well if he's aware of that. But there's always that opportunity to try. Medicare can seem like a big brick wall, but sometimes the only way we can really make a dent in that is to apply. And there is an appeal process that folks can go through with most funding sources. Sometimes that can bring it up to a higher level where someone can spend a little more time and learn about why this seating can make such a big difference for that client. All right, I have another question. What other manufacturers would you recommend besides Seating Dynamics? If you go to that original webinar that I recorded, we went through lots and lots of different manufacturers in terms of ones available in the United States, particularly for various options at the head, the back, and the feet. So kind of another whole topic there, but I would refer you to that webinar. And if you can't find a link to it, we certainly can provide one to you, and you can get more of that information. Great. I'm making sure. Oh, and we had another question here. Can we use Seating Dynamics on power chairs? Yes. Many power chairs are compatible with dynamic seating at the back and the head. The feet get a little trickier. Some of them are compatible, but if you are using a power wheelchair with that center mount foot plate, those are not compatible right now with any dynamic footrest that I'm aware of. If you go to the Seating Dynamics site in particular, if you look on their back page or the dynamic footrest page, there's a list of compatible manual and power wheelchairs. And if the chair that a client has is not on that list, you can always contact them to see if that's something they may be able to accommodate. It may just be a chair that they haven't come across before, and they might be able to accommodate it for you, because they're capable of doing some custom work. So I hope that's helpful. You know, boy, a while back I was always actually quite hesitant to consider dynamic seating on power chairs. I was afraid that it would have its own risk, like perhaps impact someone's ability to drive, or maybe move a foot, for example, in the way of an obstacle while someone was driving. But I have several clients that are using dynamic seating actually very well with a power wheelchair, and some of them drive better with dynamic seating than they do without it. So always a learning process. Great. Any more questions or comments? Feel free to just pop those right into the chat box. Oh, I have another one up here I almost missed. What about dynamic seating in a formed seating system, a molded seating system? And Jason, you must be in my area because you've listed an ASO, Aspen Seeing Orthosis, and certified, because they're both in this area. You know, I've actually used dynamic seating, dynamic backs quite a bit with molded seats, and since I'm in the Denver area, quite a lot with particularly the Aspen Seeing Orthosis. And we've had some good luck. The Aspen Seeing Orthosis is a molded seat that is a one-piece system. Well, with a one-piece system, we really can't add dynamic seating, but Aspen will articulate it for us. So they put a little slot in there, so there's some movement. It will only move a certain degree without creating shear forces, because we are talking about a molded system at this point. But if there's not a huge amount of movement, I actually find there's less shear than if the person doesn't have a dynamic back, because the dynamic back allows the client to maintain contact with those surfaces instead of moving across the surfaces. If you want, actually one of our blogs was about this very issue, about using molded seating with a dynamic back. And but again, I've had some good success with doing so. Probably our biggest barrier was getting the pivot point right, because those two particular molded backs tend to sit a little further ahead of the back canes. It's important to make sure the back canes as close to the back of that as possible. All right, I'm going to just make sure here that I haven't missed any questions, because we had a lot of great questions here. So I'm just going to scroll through these. If you're typing, feel free. And I think, oh, here we go. One more question. Does dynamic seating provide demos so we can complete a trial for insurance purposes? Great point. It's really hard to recommend this stuff without actually trying it. So I would contact the manufacturer of the product that you would like to try and see if they have a representative in your area, or if there's any way they can provide something for you to actually try with the client. And I would take lots of pictures and videos. So here's a picture of my client without this dynamic component. You know, one of those, my client standing up in the seating system. And then here's the client with the dynamic component. And this is why we need to recommend it. And I would definitely request those. It's certainly not a guarantee. Some of these are smaller companies, but I would absolutely ask about that and try it out. Well, we're right at 10:30, so I'm going to let Beckett wrap this up for us. And again, I want to thank you, everyone, for joining us for this webinar here today.